You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Hi, I'm Dr. Martin Jr.
I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 198. And today we want to talk about something that you and I have had a discussion about off the air, and we've talked about this many times, and it revolves around the idea of how often cardiologists have gotten things completely wrong over the years.
Yeah.
Which is, I mean, listen, they do a lot of things that are right, and we're not here to bash cardiologists, but when they get behind something as a group, they've been wrong way more times than right.
I'm trying to think of when they got it right.
Well, that you and I, and that's what we were trying to do. We were trying to figure out when did they get something right, and we couldn't think of anything. Yeah. And we're talking as a group. Yeah. We're not talking about individual cardiologists and the work that they do, but we're saying as a group, when they've gotten behind a public movement, they've gotten it dead wrong, and sometimes completely on the opposite end of wrong. Yeah. I mean, they've been dead wrong on numbers of issues. So what we want to do today is talk about some of the biggest mistakes they've made in terms of promoting heart-healthy ideas. And we'll talk about those because some of them, we were laughing about a few of them. They were actually, we were quite amazed how often they get these things wrong. And the reason why we want to talk about this is because, you know, the American Heart Association came out last year and said 50% of, you know, almost half of the population in the United States, but this is definitely true in Canada as well. They're saying half of the population has heart disease, some form. Yeah. And they're basing that on, you know, certain biomarkers, and then, you know, but they're saying basically half the American adults, half the Canadian adults for that matter, have heart disease. So, I mean, it's a big problem.
It's a big problem. It's a killer. It still beats cancer, you know, in terms of the number one condition that it's still number one.
Yeah, it's still number one.
Parade,
it's on the,
right? Cancer's right up there, but it still beats cancer.
It still beats cancer. And then, you know, you and I have talked about this before. Overseas in the UK, dementia has climbed up to
crazy.
I mean, it's just insane. But yeah, when it comes to heart disease, heart is still the number one way that a majority of adults in North America are going to die. Yeah, no question.
And I think it's probably the number one thing that, in terms of medication.
Yes, I mean, like the number one, biggest drug of all time, is a statin drug. So let's start there. Okay. We'll start. So obviously, if we were to list, we'll just go back and forth, name off some of the biggest things that cardiologists got completely wrong when it came to public health.
Cholesterol.
Let's start
number one.
We'll start with cholesterol, number one, right? Yeah. Cholesterol. I think we're living in a time now where people are starting to finally understand that cholesterol is one of the biggest myths. I mean, has there been I can't think of something that has been maybe when it comes to saturated fat, but when it comes to cholesterol, I mean, that idea of cholesterol being an important indicator of heart disease was thrust upon society to the point that we still get emails every day asking about cholesterol. How do I lower my cholesterol? How do I lower my cholesterol?
And, you know, go to a teaching that I did on blood work to look at, you know, what are important markers, triglycerides, and cholesterol.
Well, the ratio of triglycerides to HDL is by far a better indicator.
It's the best biomarker at all together to look at heart disease, right? And I explain it. But my word, when you think, I mean, it's almost, we look back now.
Number one selling drug. Yeah. Crazy amount of money. They've hundreds of billions of dollars sales of statin drugs, which are cholesterol-lowering medication.
And think of how that influenced people.
Yes.
Across
the
point,
board.
You know, and we probably have, I'm sure it's on a podcast, so we mentioned this too, that it actually got into the British Parliament that they had a vote. It didn't pass, but when you think of that, it actually got a vote, was to put statin drugs in the drinking water, for heaven's sakes. Like, are you kidding me?
And here's the thing. What they're starting to find out now with statin drugs are the myriad of side effects that go along with them.
50% become diabetic.
50%. And here's the thing. when it comes to the benefit of statins, there really is no benefit of statin. We're talking, it's funny. It's all math how they do it. It's a 1% improvement rather than a 50% reduction. It's just math. You could say it. If you go from 2% to 1%, so, and this is what they've done. This is actually how they've done it. So when they say, they don't tell you the numbers, they'll say it's a 50% reduction in relative risk. Whereas what they're not telling you is that it's going from 2% to 1%.
Effectiveness.
So it's, So it's rather than saying it's a 1% improvement, which sounds idiotic. I mean,
why would you?
If I were to give you a pill here, you come to see me, and I'm like, all right, you got high cholesterol, we got to bring it down. Now, there's a chance that this may damage your muscles. There's a chance it may damage your nerves. There's a chance it may cause liver damage. There's also a chance it may mess up your hormones. There's also a chance it may cause cancer. It definitely may cause diabetes. It might actually, in the long run, hurt your heart. And it may cause birth defects, but it's going to help lower cholesterol and give you a 1% chance improvement. Yeah. I mean, it sounds stupid.
And it's always interesting to me that one thing that everybody will agree with, I mean, even in mainstream medicine, is that when you take a statin drug, you're lowering your CoQ10 levels. And guess what? Your heart doesn't work properly without CoQ10. It just doesn't. It's almost like, are you kidding me? This was passed off as science, as a consensus amongst the American Heart Association.
Oh, and they got fully behind it, to the point that as soon as you're 40, you're checked for cholesterol and you're on statin drugs, right? Yeah. And I mean, now you're starting to see it swing the other way, which is finally, but it's still not enough yet, because like we said a few minutes ago, we get emails every day, people asking, how do I lower cholesterol? Whereas the response that we always give is, all right, okay, let's just put cholesterol aside for a second. What's your triglycerides? What's your HDL? Yeah. Are you insulin resistance, right? Yeah. Because, one of the best, our favorite indicator by far of potential heart disease in your future is insulin resistance, high circulating insulin.
Absolutely.
And we're going to do a webinar coming up on heart, and we're going to talk about how that is by far the best indicator. But in your blood work, like, what's your HDL? What's your triglycerides? That's where it matters. Yeah. What's your CRP? What's your inflammation levels?
And that's the true indicators, because, you've said this before, like when you look at LDL, because people ask me all the time, what do you think my LDL, is it good? I go, I don't care.
No.
I really don't.
No, because in context, right? It's always context.
Yeah, it's always like, no. I'm not. It's not that.
And here's the thing:
if you lower your LDL, it does nothing for you.
Of course not, because you can artificially lower it with a drug and still feel terrible, still get dementia, still get heart disease. No,
it doesn't help you by lowering your LDL. So I always ask my patients, why do you want to lower LDL?
Fake health.
Oh, my doctor wants to lower LDL. Why?
Yeah, because to them, and that's the thing, it gives you a sense of fake health, because you can have everything else off, and yet your LDL's down the normal, and your doctor's like, good, we brought your cholesterol down, right? I mean, that's a good thing. So your relative risk, they say, went down. Yeah. That's not true. Yeah. But I mean, that's a big one.
Let me just give you one other thing that is fascinating. I watched it happen about 15 years ago with cholesterol medication, statin drugs. The American Diabetic Association and the Canadian Diabetic Association, in conjunction with the American Heart Association, decided to give every diabetic, there was an edict that came out to the doctors, family doctors, and said, look, if your patients have diabetes, then because with diabetes, you're always at a much higher risk for cardiovascular disease, which is true. It's absolutely true. So they said, you know how many hundreds of thousands of people that had normal cholesterol were put on statin drugs because they were diabetic? And then they find out, but seriously, that really happened. I watched it happen. I had patients come in, they're diabetics, and they go, well, I'd look over their medications. I said, well, why are you on cholesterol lowering medication? Oh, I don't know. My doctor put me on. So why did your doctor put you? I said, your cholesterol is completely normal. Yeah, but, anyway, like imagine, they got that wrong too. And as a matter of fact, what did we just mention at the top of the show? that 50%, and especially women, the percentage is much higher, that women that take statin drugs are almost invariably going to become diabetics.
Yeah,
well, for heaven's sakes.
And then diabetes, one of the end results of diabetes is dying of heart disease. So it doesn't make sense. I want to give you a couple of stats here. I looked a few things up as we were talking here. Lipitor, which is really the king of statins, that's the big one. That's the best-selling prescription drug of all time. $149 billion between 1996 and 2016. $149 billion.
You know, why didn't I get a piece of that pie?
Why? And that's obviously, I mean, what I just read to you right there is the reason why it was pushed as hard as it was, right? And now, okay, let's flip it over and talk about some of the research here. So a large study done showing that out of 100 people who take statin drugs for 5 years. So let's put aside the side effects that a lot of people experience that don't even get registered as side effects. But let's just push those aside. So out of 100 people who take statin for 5 years, 2 avoid myocardial infarction, 98 don't experience any benefit, 0 mortality benefit. 5 to 20 of those people experience significant muscle aches, fatigue, cognitive dysfunction, increased risk of diabetes. So that's just from one study. Now, another study that really kind of put the nail in the coffin of cholesterol, this is a quote from the study. It says, there is no evidence that high levels of total cholesterol or bad cholesterol cause heart disease, according to a new paper by 17 international physicians based on a review, and here we go, of patient data of almost 1.3 million people. So, again, cholesterol's fake news.
Yeah, cholesterol's fake news.
It's fake news. I mean, at the end of the day, if that's the only indicator that people are worried about, it's absolutely fake news, which is why, again, when people email and asking about cholesterol, there's so much more to the puzzle that's way more important than cholesterol. And so one of the things that you and I are going to talk about more in detail on our webinar we're going to do, and if you're listening to this episode in the future, that will be available on our website. You can just go there and grab it on our website. So there was another study, and I like this study a lot because it gives you a very good idea. And what they took 200 people and they classified them based on their level of insulin resistance. So high level of insulin resistance, moderate insulin resistance, and low to no insulin resistance, right? And so they followed them for 6 years to see who got heart disease. And here's the thing: heart disease, stroke, cancer, hypertension, or diabetes. And 200
all
people
the big ones,
divided into thirds based on where they fit on the insulin resistance scale. None in the lowest third became ill with anything. Think about that. So the number one indicator of heart disease, or disease for that matter, is insulin sensitivity. The more insulin resistant you are, the more likely you are to have heart, cancer, stroke, high blood pressure, everything. So we'll talk a lot more about that in our webinar, but that's a much better indication than cholesterol. When so people message us asking about cholesterol, or their doctors, we hear it so much. A majority of people that come to see us are on cholesterol medication.
And think about what you just said. Like, if you come back to the 2 markers that are routinely done, insulin's not routinely done ordinarily, right? But if you look at the 2 markers that are routinely done for your lipid profile, your heart profile, you're going to get your HDL numbers and you're going to get your triglycerides. Well, guess what? If your triglycerides are high, your insulin is high.
Well, and here's the thing about triglycerides. Triglycerides is really a good indication of a couple of things. One being your fat cells are full.
The liver's full.
It's
the
full.
The suitcase is full, man.
So now you have circulating fat rather than right? So it's not it's an indication of insulin resistance in a lot of ways for a lot of people. We always kind of roughly called it your carb tolerance indicator. The more carbs you're eating, based on your carb tolerance, there's a good chance that your triglycerides go up. And we've talked about these things in past episodes. But the bottom line, for the purpose of this episode, they've messed up. They've missed the mark on cholesterol. To this day, you talk to cardiologists, ones that are not keeping current, they're still talking, you go see a cardiologist, they get you on statin drugs. Some of the newer ones, and we've heard this, we've had people tell us that, you guys, it looks like you guys were right. We've heard that from cardiologists. They said, looks like you guys were right on this one. Yeah. And the funny thing is that it's not even crazy to say because it's in the research. All right, so we talk cholesterol. They've missed the boat on cholesterol. The second thing that they've absolutely 100% missed the boat on was fat.
Yeah.
They've, again, They've talked about saturated fat, artery clogging saturated fat. Low-fat diets is the way to go. A low-fat diet, your blood vessels will be clean. They'll be pumping no problem. Except there's zero research to back any of that up. There's no research showing that saturated fat causes any kind of heart disease. I mean, it's crazy that in 2019, when we're recording this episode, that people still associate saturated fat with artery clogging fat.
Well, you see it. You see it. It's in the news. Again, you watch because they're going to put a tax on meat. They are going, right? The tax is coming. They're talking about that in Canada. They're talking about it in the United States. They're certainly talking about it in Europe, taxing meat. But not only that, they want to make it illegal. Like, if they had their way, a lot of people they wouldn't even let you eat it under any circumstances. Well, for two reasons. One's the climate, and I go crazy.
Well, and listen, even we should talk about that as well at some point in a future episode, because the one study showing that we got to reduce meat consumption by 40% by a certain thing was actually funded indirectly by Al Gore, which is, we all know his position on things. But anyways, it's an agenda based.
Yeah, it's an agenda based.
It doesn't matter what your opinion on meat is. That's bad science. Yeah. Terrible science. Yeah. We should not be making any decisions based on those kind of studies. And it's not a coincidence that those studies are out now when you got one of the largest IPOs in history with Beyond Meat, all these guys coming out with their plant-based everything. It's no coincidence that these studies are coming out at the same time. Their stock is, it's just exploded out of the gate. I mean, again, just like cholesterol drugs, just like pharmaceutical drugs, it's the same concept, same idea, propaganda, fake stuff.
Well, look at eggs, which would be what they consider a saturated fat, right? Yeah. The fat that's in an egg.
Cardiologists
don't eat the yolk, man. That's
have been
cholesterol.
A yo-yo on eggs.
Yeah.
Right? They're good for you. They're bad for you. They're good for you. They're bad for you. Again, saturated fat, bad for you, like the cholesterol in eggs. I mean, everything. The cholesterol in eggs have caused more seizures in cardiologists. They can't figure out what to do with it because their dogma tells them that cholesterol's bad, yet they know that eggs are good for you. So every once in a while you get an article written for
and my generation, remember, my generation, we went hook, line, and sinker, right? Like our generation, somebody that's, I'm 67 years old, in the 70s when you were just a baby, guess what? I mean, eggs are bad, man. Cholesterol, that's going to kill you. Like, you got to, brought to you by Post Frosted
Kellogg's,
Flakes, right? Like,
and the low-fat craze went full peak when you used to see on candy low-fat, like Twizzlers, low in fat, because back then that's all that mattered, right? I mean, you can eat Snackwell cookies, which are vegetable oil-based, sugar, everything, but they're low in fat. It doesn't matter because
low-fat ice cream,
which is the cardiologist got behind in Canada, the health check, that health check thing, and again,
it was all fat.
It was all based off fat. Didn't matter the sugar content. It didn't matter anything. Some things would fail, and you see this in other countries around the world. Like an avocado fails whatever their system is. An avocado fails
but
it.
Frosted Flakes
would pass it, right? So it's crazy, but they got that wrong as well. And so they got cholesterol wrong. They got fat wrong. Those two things there has led to a public health crisis, in my opinion, is responsible for a ton of bad dietary advice. Yeah. So they got, let's get into that. They got carbs wrong as well. Yeah. They got fat wrong. So, I mean, again, diet, cardiologists got diet wrong. Salt. Here's another thing. They went after salt. It didn't matter what you were eating, but eat a low-salt diet. Well, first of all, a low-salt diet is terrible. And I'm not talking about bad for you. I'm saying there's no reason to live if you have to eat a low-salt diet. Yeah. You might as well pack it in. It's game over. If you can't eat and enjoy salt in its purest form, I can't get over it. So that's their solution, low-salt food. So now you're eating bland everything because somehow it doesn't matter the sugar content in there. It doesn't matter the glycemic response of that food. It's the salt that's the problem. Yeah. And therefore eat a low-salt diet. Of course, research has come out.
No.
completely wrong on that. Salt is not the issue. It turns out, which any biochemist will tell you, insulin controls water retention. There's a lot of things that go on behind
It's amazing what happens to your blood pressure, right?
When you
go on a low-carb diet.
That's right. And you see that all the time. People, their blood pressure gets better. Their biomarkers get better.
Yeah.
So, again, they got salt wrong. And we could do a whole podcast on salt, and there's been some really good books written on salt and how the research was just completely wrong on salt. Again, so, I mean, they got salt wrong. Now, let's talk about some of the recent news they got wrong. They got aspirin wrong.
Yeah.
I mean, they got aspirin completely wrong.
Yeah.
How many people?
How long have we been saying
millions
that?
of people have been taking aspirin every day for heart. Now they're coming out, stop.
Well, we used to tell them to stop in a way. Like, we didn't want to, we never want to tell people not to take their meds, right? But if a doctor had told them to take aspirin, I didn't want to tell any of my patients, look, to stop doing that. But
well, you wanted to read a whole bunch of research on it.
But I used to
so
give
you can
them
see.
some real good reasons to talk to their doctor, right?
Yeah.
So, like, I used to tell my patients, like, you got to quit having, like, aspirin's not a vitamin. It's not a little wee vitamin that you take,
Like they have an aspirin deficiency.
Yeah.
Just like a statin deficiency, right? Like you're statin deficient, you better take a statin. You're aspirin deficient. But again, now you did a Facebook Live on aspirin that's been viewed, I don't know how many, 500,000 times?
Yeah, it's crazy.
And that came out before the news was coming out really on aspirin. And you were just talking about how, the issues behind it. But, yeah, they've gotten aspirin wrong. So let's just keep score for a second.
And
here.
the FDA has come out and told
they told Bayer stop.
They told Bayer aspirin and the other makers of aspirin, like, you're not making claims.
But how many years have
like
people
that.
been taking aspirins every day and it's eating their stomachs alive?
Yeah. Like, if you got a stroke and you got a chance to somebody to give you an aspirin, I got no problem.
Yeah, that's right.
But they're finding out the benefits of aspirin on a daily basis versus the negativity and the side effects. They said, you stop telling people. It's just no good for you. And when the FDA tells you to stop, they did it.
Oh yeah,
with their it wasn't easy to get.
No,
them
you
to
can
do
imagine
that.
you can imagine the meetings when that came up, right? They like, do we have to? And then people are like, no, we don't have to. And then 35 meetings later, they're probably like, I guess we probably should stop. Tell people to stop.
Yeah.
But again, at the end of the day, and that's another thing too, they got the little. I mean, they expect us to trust them with all their things, and they can't even get a little pill like aspirin right. Yeah. And you think about that for a second. They are so adamant on all these things, right? So, again, let's just keep score for a second here. So they got cholesterol wrong, saturated fat wrong, they got carbs wrong, they got sugar wrong,
salt
wrong, aspirin wrong.
7.
And those are all big platforms. Those are really big platforms. Those are things
why
that
we get excited all the time. This.
Why do we get frustrated? On the flip side is that we get frustrated
we
because
get jacked up because it bugs us that people are. This is why we're so information based. Like we give a lot of information. We want people to you got to at least read.
And we're called by a lot of times we hear that we're crazy, right? We have crazy views or we're outside the box thinking. And we're nuts, but the reality is, I mean, listen, I'm a little crazy. I have no problem saying that. I have no problem saying that. I rarely believe anything I read because I can, for every study you pull up on one side, I can pull up 2 on the other side. It doesn't matter. Yeah. And of course, research in itself is corrupt. Even the editors of these journals will tell you that most of the studies are wrong. The math is bad. The statistics are wrong. They don't say anything. There's a study that somebody did, which was funny, talking about how sometimes studies are stupid. They've never tested the safety of a parachute because the only way to properly test a parachute, research scientific-wise, is a double-blind, placebo-based, and nobody's jumping in an airplane without a real parachute. Yeah. So, I mean, it goes to show you some things you don't have to study to see that they're effective, like a parachute. Parachutes, if you're jumping out of an airplane and one person has a parachute and the other one doesn't, one's going to live and the other one isn't. Yeah. You don't have to do a study on it. There are a lot of times in real life situations, you don't need to research what you can visibly see. Yeah. A lot of times, research actually does harm more than good because look what's happened with the sun. You and I are recording this outside. It's a beautiful sunny day. And research has scared people away from the sun to the point that now it's gotten crazy. It's gotten stupid when, in fact, we're going to talk about this on the webinar, being out in the sun lowers triglycerides.
Yeah.
Being out in the sun raises HDL.
Isn't that crazy?
Being out in the avoidance of sun. I wrote an email that's going to go out that went out by the time people are listening to this episode. It's like how to get Alzheimer's. If you wanted to set out to get Alzheimer's, how would you get it? One way is just avoid the sun all the time. Never go in the sun because you're scared of it. See, research has scared people because what's happened is that there was skin cancer, and they said, well, it's got to be the sun because, I mean, even though skin's an organ, skin's the largest organ.
Yeah. It's inside out.
Does it only make sense that the very same things that can cause cancer of your liver can cause skin cancer? Of course it can. So why does it always have to be an external factor when majority of the time it's an internal thing? Plus, skin cancer rates in office workers is higher than those that work outside.
And especially the deadly cancers, the melanoma.
So, I mean, there's a lot to it, more to it than that. Then they come out with suntan lotion, then they're finding out that's, I mean, it may help not age the skin as fast, but it definitely does nothing to prevent cancer. May actually cause issues, especially if you add heat and jump in chlorine pools, and it's killing the oceans, it's killing the lakes with all the chemicals and all that kind of stuff. Yeah. So, I mean, a lot of times science doesn't advance things. It actually confuses, it scares people, and causes a ton of health issues because people are staying away from it as a result of one study that they've read. So a lot of times you and I are skeptical when it comes to a lot of the stuff we read, but we do read a ton of studies. I read studies every day, a couple hours every day, really, just looking for stuff. But anyways, at the end of the day, this is a long way of saying that cardiologists, when they get together as a group and they get behind a topic, they're dead wrong more times than not. And that really should be a cause of concern for them if they were being honest with themselves. You would think at one of their meetings they would say, listen, we've been wrong.
Yeah.
If they had a wall of causes they got behind, there'd be a wall of shame.
Yeah.
What causes have they got behind? Ultimately, that is
stop smoking.
That's it. I was just about to say the same thing.
Stop smoking.
That has been
They got that right.
They got that right.
They got that right.
Yeah. Smoking. That's
the only dent. That's what always bugs me. You don't need a lot of money in research to figure out that smoking was bad for you, right?
Very interesting. But yeah, so you're right. So again, we just wanted to share this with you because it was a discussion that you and I were having.
Well, it jacks up our blood pressure, right?
It does. My watch tells me to
blood
breathe.
Pressure medication.
Yes. Yeah, well, that's another thing.
So jacked up.
They've lowered the definition or diagnosis, right, so that more people have high blood pressure, even though that's the last one. So the eighth one.
Wow.
That we want to end with
talk about that
is blood pressure. They've gotten that wrong. And I'm not saying that high blood pressure is not good for you. We're not saying that. Because we know midlife high blood pressure increases your risk of dementia or Alzheimer's in the back end. There's a lot of, we're not saying that high blood pressure is not bad.
But what causes high blood pressure?
Yeah, and how they treat it, right? By studies have shown this, that people that are getting treated for high blood pressure doesn't affect mortality rates one way or the other. So again, because just by artificially lowering blood pressure without getting to the root cause, you may bring the blood pressure down, but they're still going to get heart disease because the underlying problem is still there. So that would be the eighth one would be blood pressure. They got that wrong.
The eighth wonders of the world.
Yeah, so very interesting. But again, we've been going on for a while, so we'll end with that. Fascinating stuff. If you're listening to this and we haven't had our live webinar yet, we encourage you to jump on and sign up for that. We're doing a webinar on heart health. If you're listening to this and we've already done the webinar, we have it available on our website. Go to martinclinic.com. And just go to the Start Here menu, and you'll see Heart Health. Just sign up, watch the webinar. And we're going to share a ton of information, some of the biomarkers that we like when it comes to heart health, what the actual research is saying when it comes to heart health as well. So, again, thank you for listening, and have a great day.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.